foam in the urine isn't random. It tells you a lot about what's happening in the body, especially the kidney and the San Jiao meridian. Let me show you today how to interpret it. What if your best health is at the intersection of modern science and ancient wisdom? I'm Dr. David Cherian. On my show, we bridge the gap between Eastern and Western medicine to help you live longer and finish your story. Welcome to the Convergence. Welcome to the Convergence podcast. I'm your host, Dr. David Cherian. I have a background as a physician with a licensed MD and also an acupuncturist practicing in Houston, Texas. And on this show, we go into a deep dive on all kinds of different symptoms and pathology and how we look at it from both an Eastern and a Western perspective, and especially using Chinese medicine to incorporate and bridge those two worlds together. And today we're going to talk about urine foam. It's a problem that is frequently out there, frequently underdiagnosed. A lot of people have it and they don't know why it happens. And today we're going to talk about it from especially a Chinese medicine perspective. So first things first, that is, what is foam in the urine? And foam in the urine just means that there's air trapped inside the urine. And the question is, how does that happen? Why does it get there? And to understand that, we need to look at the kidneys. The kidney qi is most closely related to the urine. And when you have healthy kidney qi, it is able to separate what we call the clear from the turbid in the urine. And so it absorbs the pure fluids and it gets rid of the turbid, it gets rid of the waste in the body. And when that process is working well, the urine is clear, it's light yellow, and it comes out smoothly and easily. But when the kidney is weak or its function is disrupted, that's when you get turbid urine, cloudy urine, foam in the urine. Those are what happens when the kidney's function is disturbed. And the kidney is also closely related to another organ called the San Jiao, or the triple warmer organ. So foam isn't automatically a sign of a disease, but it does mean in Eastern medicine that the kidney is being disrupted and something's not going right in the kidney's ability to separate the clear from the turbid. There's a few reasons in Chinese medicine that there can be foam in the urine, and some of them are not pathologic, they're okay. And in Chinese medicine, we need to separate what's abnormal versus what might just be a normal variation. Some of the common reasons that you can have foam in the urine are strong qi movement, concentrated urine, and then damp heat in the body, and maybe from food. Now, typically, if this is a more benign thing, then we're not going to see it happen consistently. If you have foam in the urine once in a while or rarely, it's less likely to be pathologic, but the more common it happens or the more consistently it happens, the more likely that something is wrong within the function of the kidney or the San Jiao or the bladder in Chinese medicine. So for example, the first thing, sometimes people just have a stronger urine stream and that can cause the qi to distribute faster and it can cause cloudiness or foam in the urine. That's not necessarily wrong unless we see other signs of kidney problems or San Jiao or health problems. It's something to note, but it's not necessarily always bad. The other thing is sometimes people can get more foam in the urine when they're dehydrated. The urine becomes more concentrated, it can become more turbid. And so in those kinds of cases, the kidney doesn't necessarily separate the turbid and the clear as well. And you'll usually know that because either you know you're dehydrated or drinking water and getting hydrated helps you feel better. But being dehydrated, having concentrated urine is another reason that that can happen. And then the third reason is also damp heat from maybe eating a heavy, greasy, hot type of meal or eating a lot of fast food. You build up damp heat in the body. That can also weigh down the kidney's ability to properly process the urine, and so it can't separate the clear from the turbid. And again, you build up foam in the urine. Now, that's also something that you would notice once you change your diet, you start eating cleaner, it goes away. But if you notice that you eat greasy food and then you start having foam in the urine, it's probably connected to the damp heat from the food. And there's probably some internal problem that's also contributing, not just the food, but it might not be directly from the kidney. And that's something that your doctor would want to check out. Now let's look at some instances where foam in the urine does indicate a deeper problem, either with the kidneys or the bladder or the San Jiao. And I'm going to give you 3 examples of problems that could be happening from urine foam. The first problem is what we call damp heat in the lower jiao, or damp heat in the lower burner. So this is probably one of the most common reasons that patients have foam in the urine. It's because of what we call damp heat in the lower jiao. And what that means is the lower part of the body has accumulated too much fluid, which is what we call dampness. And that fluid has also become a hot type of fluid, or there's extra heat or excess heat that can't get out of the body properly. And so we call that damp heat in the lower jiao. And when it affects the kidneys, it causes a stress on the kidneys, and the kidneys can no longer separate out the clear and the turbid. And all that excess dampness and heat starts to just kind of leak out into the urine. And so that creates the foam, and you might also see cloudy urine. Sometimes patients with these problems may have more urinary tract infections. They might feel urinary frequency, like they have to go to the bathroom all the time. When they go and try to use the bathroom, actually they don't have much urine, but they always feel like there's urine that needs to come out, or they have a sensation to go. They may also have what we call urinary urgency, where you feel fine 1 minute and then all of a sudden you feel a need to urinate and you have to rush to the bathroom very quickly. So those are different signs that you may have damp heat in the lower jiao, and that's one of the common reasons of have foam in the urine. Another common reason that you might have foam in the urine is because of spleen qi deficiency. So spleen is considered the middle part of the body. It's the middle jiao. And the spleen is also very responsible for water metabolism from a Chinese medicine perspective. So when the spleen qi is weak, the spleen can't metabolize the water properly. And similarly, the water starts sinking down into the bladder area, into the lower jiao, and it starts causing dampness to build up, and it comes out through the urine and through foam and urine turbidity. Typically, patients who have spleen qi deficiency, they're going to have other problems. They're going to maybe feel very fatigued, tired, they have lassitude, they don't want to talk much, they feel a sense of heaviness, they get bloated easily. Those are all signs of spleen qi deficiency. So if you have urine foam, we're going to look to see where is it coming from, the lower jiao or the spleen or another organ that might be involved. The last common problem that we see is kidney qi not firm, meaning when the kidney qi is weak or the energy of the kidney is weak, you can also have urinary problems in urine foam. And the reason for that is the kidney qi is what's responsible for what we call securing or astringing the essence and holding in the nutrients that are not supposed to leak out. But when the kidney qi is weak, it's not able to separate out the waste in the urine and retain the good parts that need to be held back in the body. And so it starts leaking out different substances that the body actually should be holding onto. It doesn't separate the clear and the turbid. And so when you have a weakness in the kidney qi, then you also will see urinary foam happening. And patients who have weak kidney qi, they could have a variety of different symptoms. A lot of times they'll have weakness in the back. They might have knee pains. Again, they might feel cold easily or tired easily. Those are also signs of kidney qi deficiency. So 3 common things are: number 1, dampness in the lower jiao with damp heat. Number 2, spleen qi deficiency. And then number 3 is kidney qi deficiency. And San Jiao, bladder, and the kidneys. Those 3 work in close harmony to make sure the urination process goes smoothly, the urine flows freely, and the body is separating the clear from the turbid and clearing out the water metabolism properly. So in Chinese medicine, the kidneys aren't just a water filter. They're not just there to filter the blood and get rid of urine. They also control water metabolism. They control how fluids move and how they're metabolized and how they're transformed. They also connect with the heart and with the other organs in the body. And so they're responsible for sending fluids up, for steaming the fluids upward. There's a lot of different aspects to the kidneys than just being a filter for the blood. The bladder is known as the minister of transformation in Chinese medicine, and it receives the fluid, it transforms the fluid, and it releases what the body doesn't need. And the urinary bladder is a major organ also in the defense of the body, in the body's defense. It's one of the largest meridians in the body. It runs all the way from your feet along your back up to your head, and it's one of the channels that are considered the most exterior and important for the protection and defense of the body. And then the third organ that I mentioned, the San Jiao or the triple warmer, that is an organ that spans the upper part of your body, the mid part, and the lower part. It spans all 3 portions, and it's the organ that is especially involved in water metabolism. It helps to distribute the water throughout the entire body smoothly. Sometimes patients have problems where they may have dryness in one part of the body, but then too much fluid in another part of the body. And oftentimes that's because of problems with the San Jiao and water distribution. So that's also a very important organ to look at if you have foam in the urine. So in a healthy state, the urine is clear. It comes out smoothly. There's no cloudiness. There's no turbidity. There's no foam. It's able to settle regularly and easily. And so in Chinese medicine, foam isn't random. It means something's off kilter. Especially, like I said, the more consistently you're seeing it. And the question is, where is that happening? And oftentimes it's in the bladder, San Jiao, the kidney, maybe another organ like the spleen. But we have to systematically look through each organ system to see where that might be coming from. So there's a few different things that I might ask a patient about if they have urinary foam, just trying to get a better clarity on where it's coming from or why it's happening. And so the first thing is the consistency. How frequently is that happening? If it's happening once in a while, it might be related to a more environmental issue on top of a pre-existing body metabolism issue or water metabolism issue. If it's happening consistently, then that's a sign that something more serious is off kilter in the body and that we need to address more directly, quickly. So that's one thing I ask, is the consistency. How frequently is it happening? The second thing that I ask for is quality of the foam. If it's a thick, stable type foam, and it's more dense and it doesn't settle, that means that the urine is more turbid than it should be. Sometimes there's a little foam and it just dissolves and dissipates quickly, and that's less concerning. But the thicker it is, the longer it takes to settle, the heavier it is, that's a sign that it's more pathologic than if it was just a light, quick foam. The third thing I look at is just what other kinds of symptoms does a patient have? Is the urine foamy and it's also turbid? Do you wake up at night to urinate? Do you have problems with urinary tract infections or burning urination or having to go frequently? Do you have edema? Do your legs get swollen or your hands or your face get swollen as well? So those are all key indicators. Some of the other things we talked about, like with spleen qi deficiency, do you have fatigue? Do you have loose stools? Do you have low energy? Do you have problems with sleep? All of those indicators are clues as to where the problem is coming from. And then fourth, especially you want to to check the kidneys, if there's any other kidney symptoms that the patient might have. Like I said earlier, do they have low back pain? Do you have weakness in your knees? Do you feel cold easily? Those are all signs that there may be something wrong with the kidney. And so that's one thing also that we want to look at when we're evaluating somebody with urinary foam. Urinary foam isn't something to panic about, but it is something that you want to get evaluated, especially if it's happening consistently and if you've noticed anything else abnormal with it. In Chinese medicine, the urine gives us a window into what's going on in the body, especially the organs of the kidney, the bladder, the San Jiao. And it's really an important clue as to how your overall health is doing. And so the sign of urinary foam could be a clue to something else that's going on in your body that we want to find out about and try to ideally fix early on. So like I said earlier, urinary foam, it could be something transient, but it could be also something that's part of a bigger diagnosis. And it's not in itself a diagnosis, but it's a clue to what might be going on. So if you like this video, please subscribe, like, and follow us. If you want to find out more information about our clinic, you can reach out to us at office@houstonacupuncture.com.
You can also visit us at www.houstonacupuncture.com. And we'll see you next time on the Convergence.